Welcome to a new video of preclinical pharmacology. So, in this video, we are going to discuss about CRP, that is C-reactive protein. In today's video, we are going to learn about introduction to CRP, discovery, structure of CRP, functions of CRP, diagnostic applications, therapeutic applications, and current research. Let's start with introduction. CRP is a protein produced by the liver in response to inflammation. It's a key marker used in medical diagnostics to assess the presence and severity of inflammation in the body. Used as a biomarker for inflammation and the diagnosis of various conditions like infections, cardiovascular diseases, and inflammatory disorders. Next is discovery. C-reactive protein was discovered in 1930 by William Tillett and Thomas Francis from Rockefeller University. They identified it as a substance in the serum of patients with acute inflammation that reacted with C, that is, carbohydrate antigen of the capsule of pneumococcus. CRP is indeed an acute phase reactant. That means the group of proteins whose levels in the blood either increase or decrease in response to inflammation or injury. And as we have seen, CRP level increase in response to inflammation. Next is structure of CRP. CRP is a pentameric protein, meaning it is composed of five identical subunits. Each subunit is a single chain polypeptide with a molecular weight of approximately 23,000 Da. Let's see some structural features of CRP. First of all, there is pentameric arrangements. CRP is a ring-shaped protein, as we can see in the picture beside, which is composed of five identical subunits. Non-covalent interactions. The pentameric structure is held together by no non-covalent interactions, primarily hydrophobic forces and hydrogen bonds. Binding sites. CRP binds to phosphocholine, a molecule found in the surface of damaged cells, bacteria, and fungi. Structural changes. As phosphocholine binds to CRP, triggers conformational change in the protein, which leads to activation of complement system. Now let's see range of CRP. From zero point 0.3 to 1.0 mg per dl, it is a normal elevation that can caused by number of factors including pregnancy, obesity, diabetes, depression, and smoking. From 1.0 to 10 mg per dl, it is a moderate elevation that could indicate systematic inflammation such as autoimmune diseases, pancreatitis, etc. But if it is more than 10 mg per dl, it is a marked elevation that could indicate acute bacterial infections, viral infections, or major trauma. And it is very severe if it is more than 50 mg per dl. It is a severe elevation that could indicate acute bacterial infections. Next is mechanism of action. As we have seen earlier also, that CRP binds to phosphocholine, a molecule which is found on the surface of damaged cells, bacteria, and fungi. So what happens? This leads to activation of complement system. So what is complement system? That is when CRP activate complement system, it gets bind to CLQ and its complement cascade leads to formation of membrane attack complex, which can lyse bacteria and damage cells, and also activate macrophages to secrete tissue factor, which leads to quick response to inflammation. Let's come to functions of CRP. First is opsonization, which means CRP acts as opsonin which enhance the phagocytosis of bacteria and damage cells of macrophages. The second one is complement activation, which we have just seen that it leads to membrane attack complex. And next is inflammation modulation. CRP binds to various immune cells, leads to increase in interleukin 6 and TNF alpha, and this amplify the inflammatory response, attracting more immune cells to the site of infection or injury. Tissue repair, and this is ultimately leads to rapid tissue repair. Now let's come to diagnostic applications. First one is inflammation marker. CRP is a sensitive marker for acute inflammation, and elevated levels can indicate infections, autoimmune diseases, cardiovascular diseases, respiratory diseases, etc. Monitoring disease activity. So, CRP levels can be used to monitor progression and response to treatment of various inflammatory conditions. The next is risk assessment. Elevated CRP levels have been associated with increased risk of cardiovascular diseases, type 2 diabetes, and certain types of cancers. Now, here are therapeutic applications. First is monitoring treatment response. So, CRP can be used to monitor effectiveness of treatments or inflammatory conditions. A decrease in CRP level may indicate that the treatment is working. Identifying risk groups. Individuals with persistently elevated CRP levels may be considered at the higher risk of certain health conditions and that may benefit from targeted interventions. Next is guiding treatment decisions. CRP level can help guide treatment decisions such as determining the need of antibiotics or adjusting the doses of anti inflammatory medications. And here comes last and the most important point of the video, that is current and future researches. First one is CRP isoforms. CRP exists in two isoforms, that is pentameric and monomeric forms, in which pentameric is most common and produced by liver in response to inflammation, whereas monomeric CRP is less common with potential anti-inflammatory properties, and research is being conducted on this. Next is CRP and depressive disorders. Research suggests a link between elevated CRP levels and major depressive disorder. Chronic inflammation indicated by increased CRP may contribute in depressive disorders. The third one is CRP and chronic inflammation. CRP is a key marker of systematic inflammation. Associated with persistently elevated CRP is linked with various chronic diseases like cardiovascular disease, cancer, and diabetes. Fourth is CRP and tissue injury. CRP is produced in response to tissue injury to indicate the inflammatory response crucial for tissue repair and healing. And the last is CRP and cancer. While the relationship is very complex, but some studies suggest link between elevated CRP and increased risk of certain cancers such as lung cancer or colorectal cancers. So guys, if you like this video, please like, share and subscribe, and thank you so much.